It looks like uh, we've got a stable number of attendees. I don't see anybody else's name popping up at the moment. Good. Good afternoon, everybody. My name is Courtney Kipps. I'm a professor of sport and exercise medicine here at UCL, at the Institute of Sport, Exercise and Health, and I'm a co-director on the program, the MSc in Sports Medicine, Exercise and Health, which of course runs alongside the postgraduate diploma. And we have both campus-based and distance learning modes of attendance. So I see 9 attendees at the moment. Excellent. You're very welcome. You'll also see on the call is Emiliana, who's kindly set this webinar up, and Atra Ajdari, who is a current student on the course. She's a doctor from overseas who's studying here with us in London. And she's kindly taken some time out of her teaching day today to come and talk to you as well, and perhaps to answer some questions if you have them for Atra as a current student. So over the next half an hour, 45 minutes, longer if you need to, we will go through, I'll briefly discuss and explain a bit about the course. Won't be for very long, just for 5 to 10 minutes. Then I'll hand over to Atra, and then we will have opportunity for as many questions as you want. You could certainly type the questions into the chat box if you want to, and depending if any more people join or not, perhaps we'll be able to open up and be able to turn on the microphones and ask the questions to us directly. I should tell you that this will be recorded, and you'll be able to review it back afterwards if there's questions that you want to pick up again afterwards. And our email addresses will be available, and you'll be able to ask me certain questions at another stage if you want to. So I want to tell you a little bit about the specialty of sport and exercise medicine. I want to tell you about learning sport and exercise medicine here at UCL, and why I think that you should come and study here, and then tell you how you'll be studying and what you'll be learning. Now, I'm not aware of your backgrounds, but perhaps some of you are already involved to some extent in the sport and exercise medicine world. Perhaps some of you already work in clinics where you see sports injury patients, or already work involved in a club or an event looking after athletes. But perhaps others of you are simply interested in getting started. And rest assured that all of our students, as they come together, we have all those different backgrounds all learning together in the same place and at the same pace. It is a genuinely multidisciplinary specialty where we have doctors, physios, sports scientists, osteopaths, chiropractors, nutritionists, podiatrists, sports therapists, all learning together. Why? Because when you're working in that environment, let's use the football club as an example, you're all going to be working together with the same ultimate end goal, which is to keep your athletes, your patients, safe and healthy. And SEM, sport and exercise medicine, is one of the genuinely multidisciplinary specialties. So yes, you'll be learning here with us, either on campus at the Institute of Sport, Exercise and Health, or you'll be learning with us online. Our campus-based students will be learning. All students will be learning on a Tuesday and a Thursday if you're full-time over the course of 1 year. If you're part-time, a Tuesday in your first year, a Thursday in your second year. If you're a modular flexible student, and that means that you want to break up your course into smaller chunks, you can do it over 3, 4, and 5 years. You can pick your modules with a little bit more selection. I said Tuesdays and Thursdays, and that's because those are our teaching days. But of course, if you're a full-time student, you'll be spending the rest of the week preparing for your lectures, reviewing your notes afterwards, doing the learning tasks, and preparing your assessments. And if you're doing the master's, the dissertation for the master's instead of the postgraduate diploma, you'll also be working on your research project and your dissertation. So if you're a part-time student, you'll be learning on campus or online 1 day a week, but you should be prepared to be studying for 2.5 days a week inclusive. Campus-based students will be on site at the Institute of Sport, Exercise and Health. Distance learning students will be able to join those same teaching sessions online at the same time, because all of our lectures are streamed live to our distance learning students. And there will be additional webinars for distance learning students. And there will also be opportunities, an expectation at the end of the year, that distance learning students come into London to learn the practical elements that you can't learn over a video. And as a simple example, that's examination of the knee and the elbow in person. But we can talk about that in a little bit more detail if you want to. Those are usually in April and May, and our exam periods will be, the practical exams will be in May. You'll be learning through a variety of different methods. You'll be learning in your class, in your small groups, and you'll be assessed in a variety of different methods. And those will be the normal exams that you might expect. But many of our exams are single best answer exams. There'll be a variety of different written assessments, and some of them are quite novel and innovative, and things that you would expect to be able to do in the big world. And that's, for example, writing an editorial, preparing an infographic, preparing a business proposal. And so there are some, I should also mention that there are individual presentations and there are group presentations, and there are OSCEs. Those are the objective structured clinical examinations for the joint examinations and for the exercise physiology module. You'll prepare a dissertation if you're doing the master's, and you'll have a viva and a presentation at the end of it. The things you'll be learning are focused around our modules. The majority of our modules are sports injury management, diagnosis and management. So those will be the lower limb, upper limb, and the head, neck, and spine. You'll be learning exercise physiology, as I mentioned. You'll be learning the principles of incorporating physical activity into health, into the prevention and management of chronic disease. There'll be an optional module to learn either team and event medicine or rehabilitation of sports injuries, which is going into more depth of the management, the physical management of the injuries. We'll spend time learning about injury prevention and going into some sports injuries in more detail in an advanced manner. Research methods is a module that all of our students do, and those who do the research project, as those who do the masters, will do a research project. There will be opportunities to learn in other environments, and we will encourage you to also look for other environments. And as an example, the London Marathon coming up in a few weeks' time is an opportunity for students to either work at or observe at, and to start putting into place the concepts that they've learned over the course of the last year. The course is based at the Institute of Sport, Exercise and Health, which is in central London. It's the home of sports medicine in London. It's part of the National Centre for Sport and Exercise Medicine, which was set up through funding from the Department of Health in advance of the 2012 Olympics, where on the basis that as London was hosting the Olympics, the worldwide Olympics, the specialty had been newly introduced and was starting to look after athletes, but there was very little available on the NHS sport and exercise medicine. And so as sport and exercise medicine became an NHS specialty, we at UCL and the wider National Centre for Sport and Exercise Medicine were able to uh, demonstrate that we were providing sport and exercise medicine care for the general population. And the advantage there is we were taking what we know from looking after elite athletes and offering to the general population as well. And so here at the Institute of Sport, Exercise and Health, we have a mix of UCL, you as future students, UCLH, our partner NHS hospital, HCA, which is a private hospital which manages sports injuries, and also the UK Sports Institute and the British Association, British Olympic Association. And so each of them have their clinics all on site in the same place where you will be learning and alongside a very strong academic team building a research portfolio. As part of your MSc, as you do your project, many of you will integrate with the academic research teams and work with them on existing research projects. So there is a huge advantage to coming to study at the Institute of Sport, Exercise and Health because it is the centre of sports medicine in London. But also it's in UCL, which is one of the very best universities in the world and has been for many years and regularly ranks in the top 10 universities internationally and for medical subjects in particular. So I recognize I'm biased, and I'm hopeful, as you will see, that the enthusiasm and passion that come through for being situated right in the middle of things, where everything around you is sport and exercise medicine. You'll be taught by equally passionate and enthusiastic teaching staff, all who have roles in various different sporting organizations and have done so over many years. Taught by doctors, physios, exercise physiologists, sports scientists, a couple of osteopaths and chiropractors will also come and talk. We've got talks from dietitians and from sports psychologists. Our teaching is run a combination of teaching from our expert faculty, but also we have an expert panel of guest lecturers, both national and even international experts who will come in and talk to you. And so you'll be learning throughout the time and building your network from your lecturers, but also building your network of fellow students. The part-time, all the campus-based teaching and the distance learning teaching will integrate with the part-time students, whether you're full-time, part-time, modular, flexible. You'll all be learning together, and some of you will be coming in and out at different times over the course of the 1, 2, 3, 4, 5 years as you choose to do. So I hope I've given you a good flavor of what you'll be doing and what you'll be learning, how you'll be assessed. And I recognize that there will probably be more specific questions that some of you will want to know. And some of that information will be just sufficient for many of you. I hope you will take from, as I've been talking, how enthusiastic, experienced, and passionate we are as a teaching faculty for sport and exercise medicine, and about how excited we are to take students through from starting knowing very little to graduating at the end of the year with a huge wealth of knowledge and skills behind them. And I hope too that you will see what a great place it is to study at UCL and the Institute of Sport, Exercise and Health. I should perhaps stop talking now, and I'll hand over to Atra, and then we'll then open the floor for questions, of which I hope there'll be many. Thank you. Atra, would you like to take over?
Great. Yeah, sure. Hi, everyone. So I believe Courtney gave you the best overview that he could possibly in this short amount of time. And hopefully I can answer your questions with the perspective of a student. So as Courtney mentioned, I'm a full-timer student right now. And I would say from my point of view, the whole experience has been like interesting and meaningful at the same time. So at the beginning, it was a bit like overwhelming because there are a lot to cover actually, and doing a master like full time, it could be demanding definitely. But the whole module is all the modules are like well designed, and as Courtney mentioned, this specialty, sport medicine, is quite multidisciplinary. And I would say in ISEH, they also value this multidisciplinary point of view as well. So that's why I really enjoyed, like in each module, we have students with really different backgrounds. And as we work through together, it gives you an idea of how like different people view the same problem and how they can participate and take part and help with that actually. So my background is I'm a medical doctor, and in our module, like this year, we were mostly medical doctors, physios, sports scientists as well. And working together side by side with physios was really interesting to me as well. And regarding the assessments, as Courtney said, they're like really designed interestingly. So you have different types of assessments, and I would say you will be assessed in different type of skills at the same time. So you have this opportunity to show yourself actually. And if you are also interested in research, I would say ISEH, as Courtney mentioned, can really help you to get your links and communicate. And because I'm into research, so it gives me like really good platforms to know people and hopefully work with them, volunteer in many possible ways. And regarding the lectures, I would say you have different type of clinicians, different points of views, different specialties, and you definitely enjoy that as well. Um, I would say that's it, but if you could send us your questions, I would be happy to help you more.
Thank you, Atra. Thank you very much indeed. And I appreciate you being open and honest whilst I'm on the call too. I see that Emiliana has opened up the webinar to everybody to make it into a bit more interactive. In which case, if you've got a question, why don't you put up your hand, press the raise hand button, and we'll take the question. If you want to type it into the Q&A, you're also very welcome to do that if you prefer. Whilst you're thinking of your questions, perhaps, Atra, might I ask you, when you were in this position a year ago, do you recall particular questions that you had or particular concerns that you had about coming to join UCL?
Yeah, sure. Because I cannot believe it's been a year, almost a year. But yeah, exactly. Last year I was in the same webinar. I do remember that. Maybe if I was back then, the question in my mind was mostly, do I get any kind of clinical experiences throughout the modules as well? And now I would say yes. And it's not only theory. And within the MSK science, you get a really good overview, and different types of examinations, assessments, and as I told you, same management could be done really differently from another point of view, like physios. And I would say that was really interesting for me. And what else? Probably one of my questions would have been regarding the research opportunities, which I find it really good. Like networking wise, there were quite a lot of opportunities there for me.
Okay. Thank you, Atra. And you mentioned clinical, and we should say that the teaching includes many different case studies and case-based discussions all the way along the line, and then the assessments at the end are based on case studies. So all of our discussions, all of our teaching is framed around what you would experience in your clinic or on the side of the pitch or in the medical room at the club. what you might expect. So thanks, Satra. James had his hand up, and then I can see a couple other written questions. So James, if you'd like to ask a question.
Hi there. I just wanted to get a quick clarification regarding for a lot of us, I think we probably want to do it part time while doing other work. And I
Yeah.
guess just in terms of if there's any kind of clash in terms of, I know lectures are on Tuesday, for instance, if you have other commitments, obviously you would try and prioritize where you can do, but is there any kind of set amount of time that if you miss or and the other question was just regarding, is there any kind of more or less a time frame regarding when to expect exams and those kinds of things so we can plan
Yeah.
appropriately?
Yeah, sure. Okay, so thanks for that, James. Look, all of our, if you're a campus-based student, and I think that's probably what you're referring to, if you're a campus-based student and you can't attend on the Tuesday when your lecture is, the lectures are live streamed and they are recorded. So you could pick it up afterwards. They're recorded for everybody's benefit, not least the distance learning students. You could pick it up afterwards. And every so often you're welcome to if work clashes. But if work was becoming a regular clash, then we might suggest that you switch to distance learning instead and plan to do most of it online. Because the campus-based students will do their practical teaching week by week, whereas the distance learning students will do their practical teaching in a block at the end. So that's the subtle difference. The obvious difference is in person or online. But the progress of the teaching is alongside, except for the practical elements where the distance learning students will do it at the end. So there, in answer to your question, yes, we can accommodate if necessary, but we would hope that wouldn't be a regular occurrence, particularly because we can plan in advance where our teaching is. I recognize if you're working in a team setting, you don't have control of that, and we understand that. You asked about the assessments, and yes, the assessments are all laid out at the beginning of the year. So a quick general overview, most of the term one assessment, so term one starts at the end of September and finishes in mid-December. There's a couple of assessments in the first 2 weeks of December. There are a couple of assessments in the first week or two of January for term one, as in the beginning, at the end of term one in January. And then for the term two, which is January to the end of March, it'll finish this time next week. We'll then have some assessments dotted through the last few weeks. And in April, there'll be a couple of assessments. In May, there'll be the residential days for the distance learning students where they'll come into London and we will teach them the practical elements. And at the end of May, we'll do the final exams, which will be the OSCEs for the sports injury modules. And then the dissertation will be submitted in July. If you're a part-time student, that would be in your second year. Finally, if you've submitted a dissertation in July, it'll be followed up with a viva and presentation in the first week of September. So I hope that gives you a flavor of how the year is spaced out. I've mentioned teaching in term one and term two. I didn't mention any teaching in term three because there is no teaching. We expect that most of term three is used for students to prepare their dissertations. And of course, there are also those other assessments in term three that we mentioned.
And can I add to that, Courtney?
Please do.
Also, there will be an Excel sheet which will be shared with you at the beginning of the first semester that you will be provided with the important like dates and the whole timeline of different modules. So you will have an understanding of how everything is going and you might be able to plan something.
Thank you.
Thank you, Atra. So Janelle asked a question in the text. How does the part-time distance program compare to the full-time in-person program? So there's two differences there, the part-time versus full-time and the distance learning versus in-person, we call it campus-based. And the answer is that you will learn exactly the same things and you'll be assessed in exactly the same way. you'll move through at the same rate. Your week one of term one will be the same week one if you're distance learning or campus-based students, and your week 12 teaching will be the same if you're distance learning or campus-based students. The only difference will be the practical elements, the knee examination, the shoulder examination, which we'll do in the residential days. Part-time students will do it on a Tuesday in the first year and Thursday in the second year. Distance learning students can be a little bit more creative about when they do those. So, Janelle, I hope that answers your question about the differences there. If I haven't quite answered, please add some more. Put in another question, and I'll move on to Sharif's question. How many people get into the course? How many people get in is not so easy to answer, but we have capacity to take between 35 and 45 new students each year. And we will offer at least that many, and perhaps most of those students will take up that offer. I hope that gives you enough information to work with. The applications are already open, and perhaps some of you have already put in your applications. We work through them in batches every month or so, and so if you put it in a month or two ago and you haven't yet heard, you will be hearing soon. They work through in batches every so often. So Isabel asked a question about the entry requirements. You only accept an academic reference. I'm out of university since 2024. I don't have many contacts with old professors, so would I only be able to apply with a work reference? UCL requires us to request an academic reference because it's an academic course. And I should assure you that all universities, most universities, are quite comfortable about looking up about this process, and they fully expect to do so. I regularly get asked to provide a reference for a student who's left a few years ago, and we are able to pull up old files, old records, and put together a reference. So I suspect that if you wrote to the administrator for your previous course, they should be able to find somebody. Usually it's your personal tutor from your time at university who will put together a reference, and that's a normal process. I feel that most universities will be able to do that. I hope that gives you enough information. Please reply back if there's more to it than that. Akhilesh, one of the doctors working in A&E at King's, regarding the fees, since I'm from India, in the UK as a skilled worker, I assume it would be under international category. I believe that's correct. Yes. Forgive me, I'm not sure when somebody from overseas becomes a home student after how long they've been working or living here. Emiliana might be able to answer that question, but certainly the admissions team will be able to help. So, V's iPhone said, thanks for the information, you're welcome. For the part-time program, could you confirm how many days are required for in-person attendance? So that will be, for in-person attendance of part-time, it is 1 day a week of face-to-face teaching, of contact time, we call it. 1 day per week as a part-time student, but we recognize that the contact time and the teaching is perhaps only a third of the overall teaching, overall learning time. And therefore, for a part-time student, you should plan to have half your week, 2.5 days, or the equivalent available for learning. And I guess my reference point is if you were a full-time or a part-time, if you were in full-time or part-time work, that's what you'd be putting aside for your education. Now, nobody minds how you break up your week, and nobody minds whether you have your Mondays or you use Saturdays and Sundays as your teaching, but ultimately you should expect to be learning for 2.5 days a week, of which 1 day is contact time. The second part of the question, in addition, are written examinations done online or in person? As a full-time clinical training collaboration made on clinical duties clash with teaching days. So different questions. Written examinations, the SBA single best answer questions are done online. The rest of them are done, the rest of the practical examination are all done in person. As a full-time clinical trainee, can any accommodation be made if our clinical duties clash with the teaching days? So every so often, if you're a distance learning student, then you can choose whether to attend the live teaching or simply watch the recordings. We encourage you to attend the live teaching, but we're not going to make you do so. If you're very welcome as a and of course, this is why many people will choose to do distance learning, because they have other commitments, which mean they can't attend on campus. So you may well simply watch the recordings after work or at the weekend. We also, forgive me if I didn't mention, so I think I may have done, for each module, distance learning students will have a webinar 3 times a term, at least 3 times a term, as an opportunity to check in with your module leader, to ask questions of your module leader, to check and for your module leader to check your progress. That is, if you are keeping up to date with the teaching, and you have the opportunity to ask questions and learn at the same rate as everybody else. So that's an expectation that you'll attend those. They're an hour to an hour and a half, 3 times a term, and then there is a requirement to attend the residential days, and those are listed a year or more in advance. Do we have any more questions? One was answered there. Emiliana, thank you, has put in the answers, put in a link for an answer to Akalesh's question. James, go ahead.
Sorry, it's just one more thing. I know you clarified earlier regarding the dates and exams and things. Just in case, what would happen if there was like a big clash with like a assessment or something and a work commitment? Just, I don't know if that's ever happened before.
Sure. No, that happens all the time, James. Life is busy, work is busy. We acknowledge that. And so and UCL acknowledges that, and so we have 2 sittings for assessment. One is the time when everybody does it, and there is a second opportunity to do it in the late summer. So that'll be in August time. And if work has clashed and meant you couldn't sit an exam on the date when everybody else would do it, you would do it in August instead. Now, it's not an ideal solution, because you may well then have a whole batch of exams all to do in 1 week, whereas otherwise it's spread out over the course of the year. But it is a practical solution for anybody who can't attend an exam. And that would be the same, of course, if you were unwell on exam day and you couldn't take an exam. It would be unfair not to give you that opportunity. Separately but related, if you didn't do very well on the exam, and perhaps, although we don't expect it from any of you here, but perhaps if you didn't pass an exam, you do have a second opportunity to take that exam and to get a pass mark, and that would be done in August in the late summer assessment period.
Thank you.
Okay. Isabel, so thank you for applying. It's a pleasure. Do we need a written letter, or do we only need to give a contact with whom you will get in contact? You may do either. In fact, Isabel, let me rather say, if you provide your professor's email address, a work email address, please, and a university email address, for example, then the admissions team will send them a request for a reference, and the reference is a structured reference, which will then feed into the application process. It is also possible to send in a written reference on headed paper from from a referee, but it is generally easier if the application team send that off. Katrina, I've been a qualified physio for less than a year. Is there a restriction on when I can realistically apply to the program based on clinical experience? So the answer to that is, if we think about our application criteria, entry criteria, is that we ask everyone to apply. We require a minimum of 1 year work experience after graduation. So if you are less than a year now, by the time September comes, I'm expecting you to have been, for most people, that will be at least a year. So your application now is perfectly fine if by September time it will have been around about a year, and give or take a little bit. As next question, and Atra, please jump in if if you've got additional answers you want to for any of these. As a specially registrar in orthopedics, could you confirm whether ICH has links with sports orthopedic surgeons or could provide network opportunities, for example, to focus on the station? Absolutely. Many of our guest lecturers are orthopedic surgeons at UCLH. Many of our research programs, some of our research programs, are run by the orthopedic team, orthopedic surgeons. So absolutely, there'll be lots of opportunities to link with the sports orthopedic surgeons. Atra, do you want to add anything to that? You've been in their lectures.
Yes, I would say for most of the modules, upper limb, lower limb, head and neck, we would definitely, like so far we had different lectures from orthopedic surgeons and also radiologists as well. And then by the end of each lecture, they will give us their email. We can be in contact with them. For example, I was interested in an observership kind of shadowing thing at my kind of level and experience. I needed that, and they were really open. And for any other kind of experience, any kind of networking, research, they're really open to that. Yes.
Good. Thank you, Atra. Akhilesh said he graduated 5-6 years ago and have been working since. I'm unsure if I get an academic reference for now. As I said, UCL asked for an academic reference, and so I would advise, if you contact the administrator for the department for the course where you did your course, that they should be able to find you somebody who can write a reference by pulling your files and going through your records from your university time, even if it was 5 or 6 years ago. That's quite standard. We get references from people who studied 10 years ago, and so that's what UCL asks. Have I answered all of those that are up there? I believe I have. Isabel, do I have to work while studying this program, for example, to be in touch with patients, or could I study full-time without being in need of clinical setting? Atra, would you like to answer that?
Yeah, I would love to. So you do not have to actually, but the program is designed if you would like to dedicate your time to study and work as well. For example, I just got my registration throughout this master, so I'm not currently practicing medicine, but I was studying full-time and getting some experience as much as I can. So if you're practicing, you're welcome, and if you're not, you're also welcome.
Thank you. Absolutely, you're welcome to it whichever way works for you. We expect that if you are seeing patients alongside, you're able to use your skills, use your learning, and it becomes a little bit more real, and perhaps that would help your learning. But we're not expecting you to go out and find patients, because because some people, like Atra, have taken a year out of their work to come and learn, to immerse themselves in the learning. And that's also fine. We will provide you with opportunities to discuss cases as much as possible, but you don't need to be in a clinical setting. Now, if you are in a clinical setting, if you have a job elsewhere, all we would ask is that you are able to block off enough time for your learning so that you don't compromise your time at UCL and your learning and the skills and the experience you'll get from UCL. So just to reiterate, if you want to study full time, we would expect you not to be working. If you want to study part time, we would expect you to be working no more than half the week. And if you want to study as a modular flexible, that bit's up to you, because we recognize you'd probably be learning in the evenings or the weekends. We also, however, we do understand that university is expensive, UCL is expensive, living in London is expensive, and people do have to work and do have to bring in some way to pay their bills. And so if you are a full-time student and you manage to get some locum work, for example, every so often, that's perfectly acceptable, as long as your work and other outside of UCL time doesn't impinge upon your learning to the point where you're not getting the learning that you expected out of it because life has become too busy. But that's when a conversation with your personal tutor will be helpful. And one example there might be switch from full-time learning to part-time learning so that you've got enough time to work and pay the bills. And that's a discussion which we're all familiar with having.
And just to add a point to that, can I?
Please go ahead.
You're also encouraged to, if you are practicing, if you're working, you're also encouraged to bring your cases, discuss it in the class, and throughout this master, you're filling a logbook with your clinical cases. Even if you're not working and practicing medicine, you can fill it out with the cases discussed in the class, but also you can bring your own cases and discuss it in the class as well.
Thanks, Atra. Atra, the next question is perhaps for you as well. What's the learning platform like, to use a particular platform like Moodle?
Actually, I was going to talk about this. Well, UCL uses Moodle as a digital educational platform. It is really user-friendly. It might take a few weeks to get it, but each week there will be uploads of the contents, reading lists, papers related to the specific tasks and like the studies of that week. So you will be pretty occupied with that based on the module you're on, like based on the study setting and your module, you will be pretty occupied.
Thank you, Atra. So, yes, we use Moodle all the time, and that's the same. It's exactly the same for campus-based and distance learning students. Distance learning students, Atra won't have seen this, but distance learning students have a little bit extra week by week, which explains to them how their learning will follow a slightly different path that week compared to the campus-based students. But it's all done in Moodle. So as I'm looking through, I don't see any other new questions at the moment. Atra, is there anything else that you wish you had asked or you wished you had known?
Maybe 2 points in my mind. First, you would not have like hands-on experiences. It's not provided for everyone in this master, but if you ask for it and if it's available, they would be happy to help you as well. And because I was curious at back then if it is provided for each module or no. And also, it is interesting how everyone are like assessed in the same way, even they have like really different backgrounds. And that's also assigned, that how each module is well designed.
Good. Thank you, Atra. Yes. So the clinical experience that we will offer you is the case-based discussions, but there are opportunities that we can help you with to get additional experience if you wish. What we can't do is we have 100 students and we can't put them all into a clinic or in a club, and the clubs would like 100 students coming in the middle of their season. So it doesn't quite work in that sense. We would really love to, but it doesn't always work, in which case we will do lots of case-based discussions. Isabel said, well, if you're studying via distance learning student, are you able to study from anywhere in the world? Yes, absolutely. We have students from the Caribbean, we have students from the Far East, and we have students from the Middle East, and we have students from London, all studying via distance learning. Would you still need to attend for the practical courses? We call those the residential days, and the answer is yes. From wherever you are in the world, you would come into London for that period in May to do the practical residential days. Now, if you're doing it so those days are all back-to-back days to make it as efficient as possible for somebody flying in and coming to stay in London. If you're doing it as a full-time distance learning student, you would come in and it's approximately a week that you'd be in London. If you're doing it as a part-time student, you would spend 2 or 3 days for one module and 2 or 3 days the next year for the other modules. So that's part of the discussion that we'd have at the beginning about how you choose your modules to make it as efficient as possible for you with the practical residential days. But yes, the residential days are a requirement for us. So we have answered a lot. It looks like there's no more questions. As I mentioned at the beginning, you're very welcome to send me an email to ask additional questions afterwards. You're also welcome to send Sean, our administrator, an email. Sean's email address is sportsmedicineadmin@ucl.ac.uk, and she will send it to whichever of the faculty is most appropriate to answer that particular question. If you want to send me an email, it's c.kipps@ucl.ac.uk. Emiliana's put Sean's email address in there, in the chat. Emiliana, is there anything else to say from your side before we call this to a close, assuming there's no more questions which pop up in the meantime? Nothing more to add from this side. Emiliana says, no, thank you. You've covered it all. The recording will be available and Emiliana will share it if you ask for it. Look forward to seeing your applications come through. Hope I've been helpful. I know that Atra has been helpful, and I'm very grateful to Atra for giving up her time to come and join us. And thank you to Emiliana for putting it together. And nice to hear the questions, and I look forward to seeing your applications. Good. Thanks very much, everybody.
Thanks. Bye.